Okay, Amy. So you're 28 weeks now, and we recommend that you have another blood test done at this stage in your pregnancy.
What's the other blood test for?
I'm just going to explain to you both.
Sorry.
We like to take a blood test to find out what your iron count is, and to screen for antibodies in your blood as
Why
well.
are they important?
Because we don't know what the level of iron in Amy's blood is now. We checked it at the beginning of your pregnancy and it was fine then, but we know that in the last few weeks of pregnancy that the baby takes all the goodness from mum and mum's iron stores, and it might be that Amy becomes anemic. Have you heard of that before?
Yeah.
Yeah?
Yeah.
Okay.
What does that mean for the baby?
The baby's normally fine.
Okay.
It's just mum that gets a bit tired and a
Yeah.
bit more lethargic, and so we want to make sure that you're in good condition for the time when the baby's due to come. Yeah. Okay. And if we did find that the results of the test were low, then as I say, that would mean that you were anemic. Then we would treat that with some iron tablets.
Are there any side effects to iron tablets or anything?
Well, there can be,
What
but
are
we could talk about that. You know, if you actually needed to have some iron tablets. Have you ever taken any iron tablets? No. Okay. So we can talk about that if you needed to have them. Okay.
Yeah.
And the other blood test that we need to do is about antibodies.
What do they do? What are the antibodies for?
Antibodies are in your bloodstream or not, as the case may be. So we took your bloods at the beginning of the pregnancy and we know that you're rhesus positive, but for some reason some women can just start to produce antibodies in the pregnancy. And it shouldn't do any harm to this baby. Yeah. But it's worth knowing whether there's any antibodies in Amy's blood. In the event that she needed, say, a blood transfusion, rare, but occasionally that needs...
Why would she need one of those?
Why are you asking so many questions?
Sorry.
Sorry.
I'm concerned.
Are you happy with me answering his questions?
Yeah. Sorry, just carry on.
You two all right?
Yeah.
Yeah. I think he's just concerned about your welfare, isn't he, really? Do you think?
Mm-hmm.
Yeah. So the antibodies could necessarily, be something if Amy needed a blood transfusion. It might also be something that could be potentially a problem in future pregnancies. So it's important that we check it out. Okay. So have you done blood tests before?
Yeah, I've only done a few though. So.
Okay. Do you want to do these, or
If
are you happy to do those?
Yeah.
So, who are you exactly? Sorry.
Oh, my name's Ellie. I'm a student midwife.
Right. Okay. Have you done this before, right?
Yeah, I've done it before.
Okay.
I did introduce Ellie when you first came in.
Maybe if you stop playing the phone, listen.
I'm not allowed to ask questions, am I?
And she needs the experience of taking blood samples, and of course I will supervise her doing that.
Yeah.
If you're happy with
That's
that.
fine. Yeah.
Okay.